for India Today with camera person Pradeep Gupta.
And as Delhi and indeed the country face what could be a critical 4 weeks in the battle against coronavirus, we're joined by a member of the government's COVID task force, one of the country's preeminent doctors, Dr. Randeep Guleria, Director of All India Institute of Medical Sciences, is joining us for our rapid fire frequently asked questions. Appreciate your joining us, Dr. Guleria. My first question in these rapid fire is this. Is it time to accept the reality of community transmission? That's a question many people are asking today, sir.
I think there are two things in this. One is community transmission at a national level. And as you know that there are the number of cases that we're seeing, 70 to 80% of them are just coming from 8 or 10 cities, which are the hotspots. And therefore, in most of the country, there is really no community transmission that is happening. It's likely that in these areas, there is some degree of local transmission happening. That is why the number of cases in areas like Delhi, Mumbai continue to rise. And we need to be aggressive as far as managing this local transmission in this area is concerned. This does not mean that there is community transmission happening all over the country.
Okay.
The second important thing to remember is that your strategy currently has to be to trace, contain, and isolate these patients, which is what is the classical strategy when it talks of containment, rather than when we talk of widespread community transmission. So I don't think we are in a stage where we can say there is widespread community transmission, and our policies continues to be what we are following right now.
Okay, our next, so you're saying it is not a nationwide community transmission. If anything, it is localized. You maintain that stand which you did a month ago. Let me ask you the second question, Dr. Guleria, which is being frequently asked. Is the month of July, the next 4 weeks, likely to be the worst as a sharp surge continues? New areas are getting affected by coronavirus. Are we seeing now, if anything, far from flattening the curve, only rising further?
So again, if you look at the country as a whole, yes, you are going to see increasing number of cases for some more time. Whether it will happen throughout July, I'm not very clear, but hopefully in certain areas, the cases will start coming down and the peak will vary from different areas. As a matter of fact, if you look at certain areas, it could be Ahmedabad, it could be certain in certain cities in the south, in Pune for that matter, the number of cases have started declining and it seems that they are on a downward trend. But cities like Mumbai, Delhi are still showing an increasing number of cases. And we're hopeful that with aggressive management strategies here, over the next few weeks, there will be some flattening and then we may see the number of cases coming down.
So the peaks will be in certain parts of the country is what you're saying. Certain parts of India will experience peaks over the next month, but it will be not uniform across India. Am I correct?
Correct. And this is what we're seeing in other parts of the world also. For example, it is in the US, the peak has already happened as far as New York is concerned, but certain states in the south are now seeing an increase in number of cases and there will peak in some time.
Okay, so there'll be a variation, you believe, over the next month. The next question, Dr. Guleria, what effect will the rains have on the virus? We are now almost well and truly into the monsoon month. Do you see it having any effect at all on the virus?
So I don't think so. When we had the summer coming in, people thought that with the summer coming in, the virus will become less, the virus will die, but nothing like that happened. I don't think we'll see a dramatic change as far as the monsoon is concerned. We will see a difference in the terms of the diagnostic skills that doctors will need, because a lot of vector-borne diseases, whether it be dengue, chikungunya, also present with fever, body aches, and can mimic some of the symptoms that you see with COVID-19. And therefore, it will be a more challenging time in terms of differentiating COVID from the other diseases that we see to a large extent during the monsoon months.
Okay, let's come to a lot of the questions being asked by our viewers at the moment. Can a person cured of COVID get it again? A few people are worried that they've been cured of COVID. Does that mean that they are now immune from it?
Yes, so it's highly unlikely that if you have recovered from COVID, you will get it again or get a severe form of COVID. And that's based on the fact that there are some degrees of antibodies which are formed in your blood, which gives you some degree of immunity, which prevents you from getting the infection again. Or if you have an exposure, you have it in a very mild form. How long that immunity lasts, does it last for a few months, does it last for a year, is something that we are not very clear about. But this does give you some degree of protection, and therefore the chances of an individual who has come out of COVID getting the infection again is very, very low.
My next question, and I'll keep putting the questions up one by one, sir. Doctor, is home or institutional isolation, what is better? Someone wants to know, they've got mild symptoms. Should they resort to home quarantine and self-medicate? Is that the basic theory that you would still prefer, that home isolation if there are mild symptoms, and only if there are serious symptoms then institutional isolation?
So here this is a commonly asked question, and there are two things that one needs to keep in mind. One is for the individual and the other is for the other family members. So if you have mild symptoms or you are otherwise not feeling that bad, you could isolate yourself at home with the rider that you are having the facility to isolate yourself at home. You have a separate room with an attached toilet, and you have a family member who can give you the care that is needed, and you are in touch with the doctor so that if you deteriorate, you can be transferred or shifted to a hospital. The second point is that you have to be careful that you don't lead to the spread of infection to your other family members or to the neighborhood. And therefore, isolation and strict measures need to be followed. What is happening is that there are certain areas where families are crowded, they can't follow this, but they prefer for home isolation, and the infection rapidly leads to a cluster developing there. And this has been noticed in certain areas in Delhi where a large number of people have isolated themselves at home. But even outside the containment zone, one is seeing that sometimes a number of cases start happening from an area because although the individual opted for home isolation, he did not have that facility, and therefore a number of people in his own family or in the neighborhood got positive. And that's why it's important that you protect yourself, but you protect others also from getting the infection.
So what you're saying, and this is very important, that if you're living in a very congested area, if you're living where a large number of your family members are living in a few rooms, then it's perhaps better to go in for institutional quarantine rather than home quarantine, even if you have mild symptoms. Am I correct, Doctor?
Yes, and I'd like to add that this is something that people prefer. You have now what we call institutional quarantine or paid quarantine, where you can paid isolation, where you can isolate yourself in a hotel or a facility which provides all the care and it's comfortable also. Many people I know who have opted for that because they're worried that if they have elderly people also staying at home, they may cause them to get the infection, and although they have a mild infection, the elderly who are staying at home with them may get a very serious infection and land up in the hospital. So I think that is why I'm saying that it's not only for your own protection, but for the protection of the other family members, that you have to take a conscious decision about home isolation versus an institution or a paid isolation.
That's a very important point you made there, Doctor. Let's turn to the next question. Can an infected person with, sorry, this is now linked with mild to moderate symptoms self-medicate? I think you've answered that question. You've suggested that those decisions will have to be taken depending on the condition in which the people around you are. You have to protect your family members, and that is very important. My next question, Doctor, at what point should a home isolation patient seek hospital admission? Is there a particular point at which you would suggest to a patient, now this is the right time to go into a hospital?
Yes, so there are certain warning signs that we tend to give to our patients who tend to home isolate themselves. If you find that you're getting breathless, if you find that you have chest pain or chest discomfort, if you're feeling very drowsy and the other family members feel that you are not able to sort of respond properly, or there is bluish discoloration of your nails or lips, or any other symptom that you feel is odd and you're not able to explain it, you must consult your doctor, and if need be, a safer option is to move to hospital. The other important issue to monitor is the oxygen saturation. And if your oxygen saturation, by now oximeters which are being provided by the government, which are not that expensive, stays over 94. In a normal individual, it should be around 97 to 98%.
Right.
But if it is over 94, you can still stay at home. But if it starts coming down or there is a falling trend, then you should consult your doctor, because then that means that you are having some degree of respiratory involvement and you need to seek hospital care.
Okay, so 94 is that number on your oximeter. I've just bought an oximeter, Doctor. My next question, are there long-term effects of COVID on heart and lungs? Can COVID patients, Doctor, get other possible ailments? Is that a concern, heart, lungs?
So there are two or three things that one follows up. Some patients, because COVID we know also leads to what we call a hypercoagulable state. It leads to more clotting. And therefore, there are some people who, because when they recover, tend to be less mobile, tend to be more bedridden because of the body aches. We sometimes continue giving them blood thinners so that they don't form clots, which can lead to problems in the lung and in the heart. So that can be given to some patients so that they don't have a long-term problem. The other thing that we noticed in some patients who have lung involvement, who have pneumonia, there does seem to be some residual scarring in the lung. I've seen a few CT patients of people who have recovered and had a CT scan done after about 2 to 3 months. There still is some scarring in the lung, although they've recovered, and that can lead to some breathlessness even later on. But as far as the heart and other organs are concerned, there's usually a complete recovery.
So it's the lungs and pneumonia which is perhaps the biggest concern at the moment if you have got COVID. We've seen that in a few case studies that we've also done, Doctor. The next question, what precaution should people cured of COVID take? This has been asked by a friend of mine who is in hospital at the moment on the road to recovery. Once they recover, what precaution should they be taking?
So once you recover, you have to get back to a normal diet, gradually start your exercise, build up your immunity, and then gradually start coming back to normal. There's really no special treatment that you require, except for what I mentioned right now, that if you are having a situation where there is a worry that you may have what we call thrombosis or clotting occurring in the vessels, you may need to take some treatment for about 4 to 6 weeks. Otherwise, it's an issue of coming out and gradually improving your activity. And also, you need some degree of moral support and psychological support, because it's a stressful time for people who are in the hospital with COVID-19.
Okay, next question. There are the drugs that are in the market now, Doctor. Remdesivir, Favipiravir or Fabiflu as it's been called, Ivermectin that's been used, particularly successful in Bangladesh. Which is the better option? Ivermectin seems cheaper, the other two more expensive. Is there a particular drug or just trust your doctor on this one?
So currently the evidence for antiviral drugs is not very strong. Ivermectin is a drug which is used for parasitic infection. Favipiravir is a drug which was used for H1N1 and then was used even in Ebola. The evidence currently for that is also not that strong. There are 2 studies which have come from China, but they are not in good peer-reviewed journals. And remdesivir, although there is a lot of data and good trials to show that it decreases the hospital admission, the data to show that it actually has a mortality benefit, that there is a better, that is not that strong. So I don't think we have a lot to say in terms of a good drug. Currently, the focus seems to be more on remdesivir in terms of what the experience is. Favipiravir is a new drug. I'm not sure that how useful it would be. We will need more data. Ivermectin, you're right. There are people who have used it both in Bangladesh, also in Mumbai, and have said that they find it to be useful. Therefore, it has potential. But I think we need more data before we say one way or the other.
Okay. The next question, and here this is the big point being made in the national capital, Doctor, is plasma therapy helping, or is it only for critical patients? Should it be only critical patients who should go in for plasma therapy?
So plasma therapy is something that is also being looked at, and there are now trials which show that it may work. Again, if you look at the literature critically, it's just one part of the entire treatment strategy. It's not the magic bullet. At the same time, plasma therapy is given to basically improve your immunity. It gives you antibodies, and therefore it is useful in the moderate to severe cases, more in the early stage when your own body has not been able to form antibodies to fight the infection.
Right.
There is some data to suggest that it may help in patients with moderate to severe disease. But again, the challenge is that the plasma that you give has to be tested to show that it has sufficient antibodies. That is being done.
Right.
Often that is not done. You just take the plasma for a person who's recovered and give it, but you're not sure how much is the antibodies in that plasma, and are you just giving plasma rather than convalescent plasma. But having said that, there is some data to show that it may be useful as an add-on treatment to what all you're already giving.
So it's an add-on treatment. I think that's an important word that you've used there. The other question which is doing the rounds at the moment on social media, do flu and pneumonia vaccines help in preventing complications, given that, as you're saying, pneumonia is a factor with COVID patients?
So in those who are at higher risk, we have been advising that they should take the flu shots, the flu vaccine, which is an annual vaccine, and the pneumococcal vaccine, which is for pneumonia. It's not that it protects you against COVID-19, so it's not a protection against COVID-19. But there are people who develop COVID-19 and then go on to develop what we call a secondary bacterial infection. That is, your immunity comes down, you will start recovering from COVID, but because you're in hospital, you're on a ventilator, you develop a secondary infection. It may provide you some protection for that, but it's not something which is going to make a huge difference as far as COVID-19 per se is concerned.
Okay. The next question, and this is a very important one, Doctor. Should the elderly be isolated from the rest of the family? If anyone in the family gets COVID, should the elderly in particular be isolated at all times? Or even if no one has got COVID in your family, should the senior citizens in your own family be kept away, isolated in any form?
So I think this is important. If we have to decrease the mortality, we have to focus on two groups. One is the elderly and the other is with comorbidities. And one way is that since the cases are increasing, especially if you have elderly living in areas where the number of cases are large or you are in a containment zone, it's very, very important to protect the elderly. They should stay indoors. They should not interact with a lot of people coming from outside, maintain social distancing, hand washing, and there should be family support or support of the neighbors to get things for them if they need it, rather than they going out to buy things, because that will lead to a higher chance of exposure.
Because
we have to protect the elderly, because that is a group where the mortality can be very
because the link to that, someone has asked, if there is a COVID positive person in the house, should other members of the family, especially the elderly who have earlier tested negative and continue to show no symptoms, be tested again, and when? Should they go and get themselves tested again?
So if you are a close contact, and that is that you have come in close contact with a positive person without any protection, without wearing your mask, and the contact has been for more than 15 minutes, and the distance is usually less than 1 to 2 meters.
Yes.
You should monitor your symptoms. And if you are very concerned and you're in the high risk group, then on the 5th to 7th day, because that's the usual incubation period, you could get yourself tested just to reassure yourself that you're all right.
5th to 7th day. And linked to that is the question, if one member of your family is positive, how often and how soon should the others get themselves tested in the family?
So again, like I said, if you are a close contact, so there are some members of the family who don't qualify as close contacts because you may not have come in contact with that person for a sufficient long period of time, or have not had unprotected. You would have been protected.
Yes.
But if you have close contact, then you should monitor your symptoms. If you develop symptoms, you should definitely get yourself tested. But if you are worried, then on between the 5th to 7th day, because that's the usual incubation period, you can get yourself tested to see whether you are getting the infection, and you may you don't want to be an asymptomatic spreader.
The next question, should people avoid public interactions that last more than 15 minutes? This is what Dr. Atul Gawande, the famous doctor from America, has suggested. Do you believe that keep the interaction short?
So like I said, if you have a close contact and you are not, both people are not wearing a mask, if the duration is more than 15 minutes, the chances of one person giving to the infection to the other goes up significantly. Okay. So therefore, if you can have communication for a shorter period, that's the ideal thing. If it is for a longer time, maintain social distancing. Both individuals should wear a mask and should regularly have hand sanitization done. That would actually be also protective.
What precaution should we take when taking a flight or when in public transport? The fear is in a flight or public transport, doctor, if someone next to me is asymptomatic, how do I protect myself?
So when you're taking a flight, you should be very careful, and that is why the guidelines say that everyone should wear a mask, because if both people are wearing a mask or you have a face shield also, the chance of an asymptomatic person giving the infection become very, very low, and that should be able to protect you.
Okay, my next question, doctor, it's an important one that a lot of people in my office are also asking. Should those with hypertension, diabetes, high BP avoid going to office at these times?
So not really. You have to take you have to do two things. One is that your primary illness should be well controlled, and that means your diabetes and other things should be under well control. And the second thing is that you must take all the precautions that we've been discussing in terms of not getting the infection from anyone else.
Okay, so yours, but would you advise them to go to office? No problem.
They could go to office if they want to. That should not be a problem.
Okay, they could go to. So these are now generic questions. My final few: does the rising recovery rate? The government is suggesting the recovery rates are rising. Is that an indication that the situation on the ground is improving, or is that simply because the discharge rules have changed at the moment?
My own feeling is that the recovery rate will rise because, as we've been saying, that the number of people who have mild infection or are asymptomatic is large. And as we start doing more and more testing, we will pick up a large number of people who have mild infection. And therefore, we will find that the recovery rate is higher. My own feeling is the recovery rate should be close to 70 to 80% or even higher than that. And this just suggests that the disease is relatively milder as far as mortality is concerned in our country.
You still believe that? I just want to press you. Do you believe that the virus, as some are suggesting, is milder in India at the moment given the low mortality rates?
So this is a difficult question. Either the virus has a low virulence, or we are somehow protected because of being a young population, or because of, like people say, having been vaccinated by BCG. So there is some less mortality, and the illness is also less severe in India. Could be because of low virulence of the virus, or some immunity in the host, that is Indians living in India.
Okay. Doctor, does wearing a mask mean no need for social distancing? I mean, you're going to have all these festivals that take place. There will be lots of people around you possibly. Is wearing a mask immunity?
A mask does help, but that is not a substitute for social distancing. The combination of the two is much more better in terms of protecting yourself rather than one alone. So even if you maintain a distance, you must also have a mask, because if you're coughing, the virus can go through the mask, and social distancing needs to be maintained so that your exposure becomes even less.
Is there a link, doctor, between blood type and COVID? Is there a link that you're seeing between blood type and COVID at all?
No, there is really no link between your blood group and COVID infection. That has not been shown.
Are pregnant women at higher risk of complication?
So currently the data is not strong enough to show that pregnant women are at a higher risk of complication. There was this concern in the beginning, and one was very cautious. Because H1N1 showed pregnancy as a high risk factor, but it's not been shown conclusively as far as COVID-19 is concerned.
Does talking loudly, and this is trouble for me, does talking loudly spread the virus more?
So if you are an asymptomatic individual, talking or shouting or even singing can lead to the virus traveling a larger distance than it would otherwise. But the maximum spread occurs if you're coughing or sneezing.
My final question, and this is my own question, doctor, is there any concern if I have to go to my dentist for any operative procedure? Should I be worried at all, or just take the necessary precautions and go for that?
So it's a two-way street. The dentist would also be worried that you could give the infection to him. So both people need to be taking precautions. The dentist himself needs to protect himself by wearing a face shield and an N95 mask, and proper sanitization needs to be done. You also need to be careful so that there's no exposure while you go to the dentist. And if the procedure can be avoided for some time, then that would be an ideal situation. But currently, dental procedures which are having what we call aerosol generation should be avoided if they can be.
Doctor, you've answered all my questions, and we'll obviously have many, many more, so we'll keep doing this as often as we can. You've been wonderful in answering them with such precision. Thank you very much, Dr. Guleria, for informing our viewers with all those answers. Thanks very much.
Thank you.
Okay, let's take a break at this point.